Hello parents. Today, let's talk about something very common but also very important: diarrhea in children. Many babies and young kids experience diarrhea at some point, and while it can be mild, sometimes it can become dangerous if not managed properly. So, let's learn together what causes diarrhea, what signs to watch for, and how parents can take care of their little ones safely. First, what is diarrhea? Diarrhea simply means frequent, watery stools. For babies, it can sometimes be hard to tell, because their stools are naturally softer. But when the number of bowel movements increases suddenly, and the stool becomes very watery, that is diarrhea. Causes of diarrhea in children. 1. Infections. This is the most common cause. Viruses like rotavirus or norovirus, bacteria from contaminated food or water, and sometimes parasites can lead to diarrhea. 2. Food-related issues, food allergies, such as cow's milk protein allergy, or food intolerances like lactose intolerance, can trigger diarrhea. 3. See medications, certain antibiotics may upset the balance of bacteria in the gut and cause loose stools. 4. Other health conditions, for example, digestive system problems or inflammatory diseases, though less common, can also lead to diarrhea in children. Now, what signs should parents look for? The biggest concern with diarrhea in children is dehydration. Because little bodies lose water and minerals very quickly, dehydration can become dangerous. Look for these signs: dry mouth and lips, sunken eyes, little or no tears when crying, decreased urination, fewer wet diapers than usual, unusual sleepiness or irritability. Other warning signs include very frequent watery stools, blood or mucus in the stool, vomiting along with diarrhea, fever, severe abdominal pain or bloating. So, what should parents do at home? The most important thing is to replace lost fluids. Oral rehydration solution, also called ORS, is the best choice because it contains the right balance of salts and glucose to help the body absorb water. Continue feeding your child. Babies who are breastfeeding should continue to breastfeed. For older children, give small, frequent meals that are easy to digest. Rice, bananas, applesauce, or toast are gentle on the stomach. Avoid very greasy or sugary foods. Watch carefully for signs of dehydration. When should you take your child to the doctor immediately? If your child is under 6 months old and has diarrhea, if there is blood in the stool, if your child has persistent vomiting and cannot keep fluids down, if diarrhea lasts more than a few days, if you notice signs of dehydration like very little urination, extreme thirst, or drowsiness. How can diarrhea be prevented? Good hygiene is key. Wash hands thoroughly with soap and water, especially before eating and after using the toilet. Make sure drinking water is clean. Wash fruits and vegetables carefully. Vaccination against rotavirus, which is a common cause of diarrhea in infants, can provide strong protection. Final message for parents. Most cases of diarrhea in children are mild and improve with proper care at home. The biggest danger is dehydration, so keep a close eye and give fluids regularly. But always trust your instincts. If your child seems very unwell, seek medical help without delay. Remember, a little attention and care can make a big difference in keeping your baby safe and healthy. Thank you for watching. Don't forget to follow for more baby health tips, so you can feel more confident caring for your little one.
Your registration does not take much time, but it gives me more motivation to share baby care tips every day.